Hi, my name is Olga Hapner and I'm the CEO of Danila Dilba Health Service. It's an Aboriginal community controlled health service in Darwin in the Northern Territory of Australia. We're extraordinarily honoured and deeply grateful for the nomination to win this prestigious award for Juvenile Justice Without Borders. It's an incredible honour just even to be nominated, much less to have actually received this award. But a little bit about our organisation and what we've done and how it sort of fits between health and juvenile justice. I need to go back to perhaps 2016 when there was a very shocking and damning documentary that was showed nationally on television here in Australia, and it was called Australia's Shame. It was a documentary that highlighted the extraordinary abuses of young people in juvenile detention. Children as young as 10, stripped naked, left in isolation and solitary confinement for hours and sometimes days at a time. Young people who were strapped into restraint chairs and hooded. It was very much reminiscent of the sorts of abuses that we saw happen at Abu Ghraib. This was Australia's shame. But more importantly, I think the thing was, for me personally, was to see that this kind of treatment was happening to children, and Aboriginal children, in today. You know, it's just incredible. And that really motivated us as an organisation to do the work that we now currently do. First of all, there was a Royal Commission and an inquiry into the treatment of those young people. That Royal Commission came down with quite significant recommendations for reform. We're still waiting to see some of those reforms to be implemented, and while some changes have been made, Australia still lags significantly far behind the rest of the world when it comes to respecting the rights and freedoms of individuals, but particularly protecting the rights of juveniles and young people in detention. We don't have a Charter of Rights in this country. We're quite out of step with the rest of the First World, and certainly with other First World countries such as Canada and the UK and so on. We're working incredibly hard to try and get some standards developed and, much more importantly, introduced and honoured, particularly for vulnerable children who are detained and deprived of their liberty. The other thing that I think I'd like to highlight is that as a health service we became incredibly aware that many of those young children in detention were not only Aboriginal, 100%, but many of these young people had come from the child protection system. A fair proportion of them, well over 60% we would believe, have at least one cognitive or developmental impairment. So it seems very obvious, this link between health and justice. And that's something that I think we're really trying to flag and highlight about, you know, the incredible vulnerability and the deprivation that many of these kids come from. In advocating for these sorts of changes, I'm hoping that perhaps elsewhere in Australia we'll start to see Aboriginal health services providing primary health care in juvenile detention facilities, being able to do the therapeutic kind of work that these kids need, but more importantly working with them to help them build a better future and to have a better life for themselves and their own children. On behalf of Danila Dilba and all of our incredible staff, a big thank you. Quite emotional. Thanks.